Pop quiz. A nurse working on the medical surgical unit has received the morning report. Which patient should the nurse assess first? One, a 45-year-old with type 1 diabetes with a blood glucose level of 60, complaining of dizziness. Two, a 60-year-old post-op patient with a temperature of 100.8, heart rate of 92, and is requesting pain medication. Three, a 70-year-old with COPD who's scheduled for a chest x-ray and has an O2 sat of 92% on 2 liters via nasal cannula. Four, a 55-year-old with heart failure who gained 2 pounds overnight and has a blood pressure of 150/88. All right, guys, so the patient you're going to see first is number one. It's not even close. When it comes to physiological integrity, again, I've said this a million times, you have to think of what is going to unalive your patient the fastest. In this case, it's going to be that patient that has a blood glucose of 60. Remember, normal is 70 to 110, right? It's different. Let me ask you something. What kills you faster, hypoglycemia or hyperglycemia? Hypo. Right? If the patient's hyperglycemic, there are so many different mechanisms that the body will use. The body will try to compensate to at least buy you time, right? You're hyperglycemic, you have polyuria, polyphagia, polydipsia, but if you're hypoglycemic, boom, you're on the ground. Normal glucose is 70 to 110. This patient's glucose is 60 and they're complaining of dizziness. What do you think is going to happen next? That's going to be a priority patient. Now, let's look at the other choices. I'll explain to you why they don't take precedence. The second one, you got a 60-year-old post-op patient. Temperature is 100.8, heart rate 92. They're requesting pain med. First of all, whenever you get a situation, it tells you the patient just had surgery, and I don't care what type of surgery it is. It could have been an amputation. It could have been a mastectomy. It could have been an appendectomy. Does not matter. If they just had surgery, your biggest nightmare is hemorrhage, infection, or DVT, pulmonary embolism. When we look at the temperature, 100.8, we're not worried about the infection. Heart rate 92, that's normal, and they're requesting pain. Well, we're requesting pain. They're requesting pain medication. We expect that. They just had surgery. There's nothing here that tells us that the patient's life is at risk. Let's move on. Choice number three, we have a 70-year-old with COPD. They're scheduled for a chest x-ray and the O2 sat's 92 with 2 liters oxygen nasal cannula. Now, granted, your normal O2 sat is supposed to be between 95 and 100. This patient's O2 sat is less, it's 92, but look at their diagnosis. They've got COPD. They have a chronic respiratory condition that we expect to see their O2 sat lowered. There's nothing here that tells us that this patient is unstable, right? By the way, patients in respiratory distress, once that O2 sat is 91 or lower. So number one, it's not even lower than 91%. And number two, they have, again, a chronic respiratory condition where this would be expected. There's nothing telling us that this patient's at risk for being unalived at the moment. Whenever you're asked about prioritization, we're concerned about what's happening with the patient right now. Last, we have a 55-year-old with heart failure. They gained 2 pounds overnight. That's a problem. After seeing that patient that's hypoglycemic, this is the second patient that we would come take a look at, because you gain 2 pounds overnight. Guess what? Whatever we're giving you, we're trying to treat that CHF. It's not working, right? So we're going to check this patient. We're going to assess them. But other than that 2 pounds that they gained, there's nothing else that's telling us this patient is in immediate trouble. And when you compare the two, when you compare this patient versus that patient that's hypoglycemic, it's going to be the hypoglycemia all the way. Expect this on NCLEX. Expect for you to have 2, maybe even 3 patients where something is wrong, and you have to prioritize. You have to say who is in the worst case scenario, and that's always going to be your priority patient.